I'm Karen Mossman, Vice President Research at McMaster University and a member of the Board of Directors of the Canadian Research Data Centre Network. On behalf of the CRDCN and McMaster, as the network's host institution, it is my pleasure to welcome conference participants from across Canada and around the world. Thank you so much for making time to join us for the CRDCN's 20th anniversary virtual conference, presented in partnership with Statistics Canada. The title of today's panel is Response to COVID-19, First Wave Assessment and Second Wave Planning. I am happy to welcome 4 panelists who will share their experience of how they are seeking to inform the response to the pandemic. Each of our panelists will present opening remarks of roughly 6 to 7 minutes. As this portion of the panel has been pre-recorded, we invite you to submit your questions as you listen to each speaker. We will get to as many of them as possible in the live Q&A session that will follow. So without further ado, I would like to invite Lisa Litz, a professor of biostatistics and a Tier 1 Canada Research Chair in Methods for Electronic Health Data Quality in the Department of Community Health Sciences at the University of Manitoba, to kick off today's panel. Her research focuses on methods for conducting population health and health policy research using electronic health databases. Lisa also co-chairs the Public Health Agency of Canada's Canadian Chronic Disease Surveillance System Data Quality Working Group. Lisa.
Thank you very much, Karen, for the introduction. It's my pleasure, and thank you to the organizers for this opportunity to participate in this panel about COVID-19 for CRDCN's 20th anniversary. So I'll just take a moment to share my slides. And so my remarks today about the evolving data environment for COVID-19 comes from the perspective as a leader in database development, linkage, harmonization, and documentation for 2 established networks in Canada. One of them is the Health Data Research Network Canada, which I'll be describing shortly. The COVID-19 outbreak has resulted in significant scrutiny about the health data environment in Canada. Discussions and actions are broad and tangible, focusing on data quality domains such as accuracy and timeliness, reevaluating routinely collected data to identify the value of new sources of data or new data linkages, and examining the privacy and confidentiality issues that emerge with increasing granularity of the data. The CRDCN and other national data-intensive networks have quickly mobilized to support data needs of researchers. Existing data in the RDCs across Canada, for example, such as health survey data, support the development of population profiles, such as populations who may be most at risk for poor outcomes, while newly collected or newly available data can be linked to undertake studies in innovative areas. So, for example, data-intensive studies about the characteristics of populations in specific geographic areas, such as this study that I completed with colleagues about a decade ago using data from the Canadian Community Health Survey, can provide an intensive profile of the populations of specific geographic areas, such as Northern Canada. This can be combined with summary statistics, for example, about COVID-19, such as exemplified by this recent study that linked country-level information about chronic diseases with additional country-level information about the number of COVID-19 tests, confirmed cases, and deaths. These kinds of ecological studies can test hypotheses about the associations of communicable and non-communicable diseases at the population level, and are useful for identifying future studies at the individual level to focus on populations at risk. Statistics Canada and the CRDCN support the production of metadata. This could include, for example, changes in survey methodology, field names, and attributes of field contents. Efficient, comprehensive searches, possibly using artificial intelligence technologies, can improve data discoverability, increasing the speed with which decisions about data inclusion and exclusion, study design, and even analyses can be made. Interpretability is a key dimension of quality, so efforts to standardize nationally and internationally support the production of high-quality documentation that can be used and reused. Statistics Canada and representatives from the CRDCN are part of a new network that was incorporated as a nonprofit organization earlier this year, HDRN Canada. So it encompasses provincial and territorial data centers, such as ICES in Ontario and Population Data BC, as well as national organizations such as the Canadian Institute for Health Information. It has a data access support hub that also opened earlier this year. So HDRN Canada has a role to play in sharing expertise and facilitating access to electronic health and social data across the provinces and territories, and has, of course, been active in COVID-19 research. Specifically, the working group that I chair, Algorithms and Harmonized Data, has compiled metadata about COVID-19 laboratory test data, including the availability of selected variables and fields in lab testing data for each of the provinces, and an overview of the data, including things like frequency of data updates and the dates of lab tests currently captured in the data for those provinces that are collecting the data and where it can be linked to other administrative health and social data. So what you see on the screen here is that these laboratory testing data are available in British Columbia, Alberta, Manitoba, Ontario, Newfoundland, and Labrador. Having access to these kinds of metadata that describes the attributes of COVID-19 laboratory test and its potential for linkage can facilitate multi-jurisdictional studies and really encourage conversations at the national level to support our understanding of the impacts of COVID-19. But we've quickly realized in capturing this information that differences in the metadata and the lack of standardization of coding of information, such as differences in how lab test results and even lab tests names are communicated, highlights the potential for HDR in Canada to source for metadata dissemination, such as international standards available through organizations such as CDISC, the Clinical Data Interchange Standards Consortium, and harmonization of that data, perhaps through the use of a common data model. So the partners here in Canada, such as Statistics Canada and CRDCN representatives, can contribute their knowledge of these standards where they may exist and data harmonization initiatives. So in closing, in my remarks, I've briefly reviewed some key attributes of the evolving COVID-19 data environment in Canada, emphasizing breadth and depth of data, quality domains, and metadata. Now, key drivers of the data evolution through the next wave of COVID-19 is, I believe, succinctly described in CRDCN's strategic plan, where it notes that as researchers evolving expectations about why and how they engage in research, as well as the means by which they use, access, process, and curate data, are important drivers of that change. So with that, I'd like to say happy anniversary to CRDCN, and thanks very much.
Thank you so much, Lisa, for your talk. You know, how fortuitous for the launch of the Health Data Research Network Canada earlier this year and its ability to tackle the COVID crisis in collaboration with entities such as the CRDCN. It's now my pleasure to invite Marie Connolly, a professor at the Department of Economics at the Université du Québec at Montréal in the School of Management, to share her remarks. She is the founding director of the Research Group on Human Capital, as well as the current data editor for the Canadian Journal of Economics. Her research touches upon various topics in labor economics, such as social mobility, the formation of human capital, the gender wage gap, subjective well-being, women's labor force participation, and the evaluation of public policy. Marie.
Hi. Bonjour. Donc, ça me fait vraiment plaisir d'être ici avec vous. D'habitude, autour du mois d'octobre, c'est la conférence annuelle où on se retrouve en personne. Et cette année, on a dû changer un petit peu nos pratiques, comme dans beaucoup de domaines. Donc, ça me fait quand même plaisir d'être ici avec vous. Et je vais prendre un moment pour partager mon écran. Voilà. Voilà. Donc, j'ai pensé que je vous parlerais un petit peu de comment j'ai fait ma recherche pendant le confinement. Alors, comme bon nombre d'entre nous, à la mi-mars, tout s'est arrêté. Et donc, on s'est fait dire ici au Québec de rentrer à la maison pendant 2 semaines et les enfants sont revenus de l'école et ne sont pas retournés à l'école. Et puis, surtout, le Centre interuniversitaire québécois de statistique sociale, le CIX, donc notre antenne locale des centres de données de recherche de Statistique Canada, est resté fermé de la mi-mars à la mi-juin 2020. Il a par la suite réouvert, mais avec un accès relativement restreint, donc moins de postes et ainsi de suite. Et donc, ça a fait en sorte que tous les projets sur lesquels je travaille, la grande majorité s'est fait à travers des données qui sont disponibles dans les centres de données. Donc, je n'y avais plus accès. Et pareil pour mes étudiants de maîtrise et doctorat que je supervise, donc plus accès aux données. Parallèlement à ça, on a eu un grand besoin, si on veut, d'avoir accès à des données de qualité, telles que les données Statistique Canada, pour pouvoir informer les décideurs en temps de pandémie. Donc, c'est sûr que ce qui nous a frappé, c'est une crise sanitaire, donc la question de la COVID, mais on a vite vu, en tant qu'économiste et économiste du travail, que cette crise sanitaire-là et les mesures de confinement allaient se transformer en crise économique aussi, en perte d'emploi et en perte de revenus. Et donc, pour pouvoir aider les décideurs, ce qu'on s'est dit, on a besoin de données sur ce qui se passe aux travailleurs. Pour ça, on avait besoin donc d'accéder aux données auxquelles on a généralement d'habitude avec Statistique Canada. Donc, ce qu'on a fait, c'est qu'on a demandé spécialement à Statistique Canada de nous fournir accès à ces données-là à distance, si possible. Et la réponse a été géniale. La réponse a été rapide et avec un grand engagement de leur part, étant donné ce besoin vraiment particulier. Et donc, on a eu un contrat qui a été fait, un peu comme un contrat d'accès aux données habituelles avec procédure de divulgation, protection de la confidentialité et tout. Et ça s'est fait à travers des ordinateurs portables qui ont été envoyés aux membres de notre équipe de recherche. Ce qui a été assez incroyable aussi, c'est qu'il y a une autre équipe qui a commencé à travailler un peu sous le même modèle, en même temps que nous. Donc, quand je dis nous, je parle de chercheurs ici à l'UQAM, à McGill, à l'Université d'Alhazia en Nouvelle-Écosse, mais il y a aussi une équipe à Vancouver, à la Vancouver School of Economics, qui avait commencé à travailler. Et ce que Statistique Canada nous a permis de faire, c'est de partager nos fichiers à travers un dossier commun, mais directement sur le serveur. Donc, pré-divulgation, là, pour ceux qui sont habitués à ce genre de travail-là. Et donc, c'est assez particulier et nouveau dans ce cadre-là. Qu'est-ce qu'on a fait? On a développé un outil interactif d'évaluation des risques. Donc, j'ai pas le temps aujourd'hui, malheureusement, dans les quelques minutes qui me sont attribuées, de rentrer dans les détails. Je vous ai mis quelques liens. L'équipe de Vancouver a travaillé sur cet outil et a développé un indice de risque. Qu'est-ce que cet indice de risque-là fait? Il calcule les risques de transmission virale pour chaque profession et c'est agrégé aussi au niveau des industries. Ce qui est intéressant aussi de l'outil, c'est qu'il est interactif. Donc, on peut aller sur le site web et puis aller cliquer les différentes bulles pour voir de l'information. On peut aussi, toute l'information qui est dans les graphiques se retrouve aussi en bas sous forme de tableau. Donc, c'est vraiment de l'information qui est comme traitée par les chercheurs et qui est mise à la disposition des décideurs. Nous, ce que nous avons fait dans notre équipe au Québec, c'est on l'a adapté au Québec parce que l'outil avait été développé pour la Colombie-Britannique. Donc, on l'a adopté à la demande de l'Institut national de la santé publique du Québec. Et puis, ce qui est intéressant, c'est que ça met en relation, si on veut, l'arbitrage qu'il y a entre protéger la population au niveau sanitaire, donc de faire des mesures de confinement pour arrêter, fermer des industries, mais aussi, si on veut, les bénéfices qu'on a à travers ces industries-là. Donc, le nombre de personnes qui sont employées, la part de des industries en termes de PIB de la province. Et donc, ce qu'on fait ressortir, c'est que il y a des risques si ces gens-là travaillent, mais il y a aussi des bénéfices en termes de revenus et d'emploi. Okay. En termes de propositions pour le futur, ce qu'on nous a demandé de réfléchir un petit peu au futur du réseau canadien de centres de données de recherche. Donc, bien que ce que je viens de vous raconter n'a pas été fait directement dans le réseau des centres de données de recherche, je pense que c'est un peu grâce au réseau qu'on a été capable de faire ça, parce que c'est grâce au réseau qu'on a l'habitude de travailler avec les données Statistique Canada, qu'on a accès à ces données-là de manière générale. Et c'est grâce aussi aux contacts qu'on s'est fait à travers le réseau qu'on a pu aller parler aux bonnes personnes à Statistique Canada qui sont habituées de partager, de donner accès à leurs données à des chercheurs comme nous. Et donc, vraiment, je remercie l'existence du réseau pour avoir permis ce travail-là. Par contre, je pense que c'est une opportunité pour réfléchir un petit peu à comment notre expérience peut aider Statistique Canada à permettre un accès à distance aux fichiers. On a un petit peu, si on veut, prouver que c'est capable. Je sais que du côté de Statistique Canada aussi, ils se sont prouvés eux-mêmes que leurs employés peuvent aussi avoir accès à leurs données en faisant du télétravail. Donc, je pense que ça, c'est quelque chose à réfléchir pour le futur. Des petits détails aussi, mais comme je vous ai mentionné, on pouvait partager les fichiers et les codes entre les chercheurs à l'intérieur des centres de données de recherche. Et donc ça, je pense que c'est quelque chose qui peut être très intéressant. Ça peut être fait à la mitaine, là, mais le faire de manière plus généralisée pourrait être très intéressant pour favoriser la collaboration entre équipes qui travaillent dans différentes antennes des centres de données de recherche. Là, ici, je vais mettre pour une seconde mon chapeau d'éditrice des données de la Revue canadienne d'économique, le Canadian Journal of Economics. Le rôle en tant qu'éditrice de données, c'est de faire en sorte que chaque projet empirique vient avec une archive de projet. Donc, un répertoire qui contient les codes, par exemple les codes Stata, les codes R, qui permettent de répliquer. Mais je pense qu'avoir ce genre d'archives à l'intérieur du réseau, à l'intérieur des centres de données de recherche, pourrait être très intéressant aussi parce que ça permettrait de faire la réplication d'autres projets. Et puis finalement, le dernier point, ici, je pense qu'un rôle du réseau aussi, c'est de promouvoir et faciliter le partage de données entre les différents paliers de gouvernement et aussi entre les gouvernements et les chercheurs. Dans notre cas, par exemple, sans avoir pu rentrer dans les détails, le risque de transmission virale qu'on a pu calculer pour les professions était un risque que je pourrais qualifier de théorique parce qu'il était basé sur les caractéristiques de l'emploi. Si on avait eu accès à des données sur les cas de COVID par profession, donc les gens qui ont effectivement eu la COVID, dans quelle profession ils œuvraient, on aurait pu vraiment bonifier notre modèle. Et je pense qu'on a rencontré un peu de résistance de la part du gouvernement québécois, entre autres, pour le partage de ce genre de données-là. Des données qui n'existent juste pas, donc les données par profession, mais aussi simplement les cas par âge et par région. Donc voilà, c'est tout. Merci beaucoup. Et également, joyeux 20 ans au réseau des centres de données de recherche. Merci.
Merci, Marie, for your collaborative research during the COVID shutdown on projects such as the interactive risk assessment tool and enabling research to occur across the country in such a collaborative manner. We will now hear from Gillian Petit, Research Associate at the School of Public Policy at the University of Calgary in the Fiscal and Economic Policy Division, as well as being a PhD candidate at the University of Calgary in the Department of Economics. Gillian currently conducts research for the BC Basic Income Expert Panel with a focus on income and social supports and tax policy for low-income and marginalized persons. Her past research includes applied economics research in the economics of legal institutions and on the gendered impacts of taxation. Gillian.
Thank you, Karen, for that introduction. And thank you to the CRDCN for organizing this and for having me speak. So today I want to talk a little bit about some of the research on the first wave assessment for COVID-19 I've been involved with, as well as how data is hosted by the RDCs can help in second wave planning or helping develop income support programs in the case of a future national emergency or pandemic. So in the short run, a whole bunch of emergency measures were put into place, not the least of which were income supports. I don't want to downplay the need for speed and the response here, but because of the need for speed, there was a lack of rigorous planning and a lack of preparedness. And this meant that some of the income support programs that were put into place, some of the details were overlooked. So in some of the research I've been looking at, we focused on the Canada Emergency Response Benefit, or the CERB. So as many of you probably know, the CERB was a temporary cash program implemented by the Government of Canada to workers who had reduced earnings because of COVID-19. So one of the details that was overlooked in the CERB was never defined properly. We don't really know what it was. We didn't know if it was a benefit like the Canada Child Benefit, or if it was a direct replacement for earnings, or if it was earnings insurance similar to the EI program. And because this question was never really answered, it had significant implications for vulnerable populations, particularly persons accessing income and social support programs. So our research looked at how different provincial social assistance programs treated the CERB. So in some provinces, like the province of BC, the CERB was treated as if it were a benefit. So persons on income assistance in BC who are eligible for the CERB received both the CERB and their income assistance benefit. Unlike in other provinces who either partially clawed back or completely clawed back income assistance benefits for persons who received the CERB. So what ended up happening here is that because this detail was left out of designing the CERB, persons in economically similar conditions were treated asymmetrically across provinces for no justifiable reason, such as a difference in impact in labor markets or a different in impacts in cost of living. So where does the RDC and data fit into all of this? So in this first wave assessment, we weren't able to do a data analysis because the data simply just didn't exist in real time. However, data in the long run data, administrative data particularly, can be used for planning for a second wave and planning for a future national emergency. So some of the questions that I think the data could answer, some of the questions that I would be particularly interested in are questions like, were income assistance clients financially better or worse off? And this could be a cross-province approach where, again, where we look at, because the CERB was treated differently across the provinces, we can look at, given this difference in treatment, were income assistance clients in different provinces better or worse off? So theoretically, it's possible that income assistance clients that receive the CERB were actually worse off because they lost not only their employment, but also their income assistance benefits. So although this is theoretically possible, we don't know how it actually played out. So the data can help answer this type of question. The data can also help answer questions like whether persons in income assistance clients in BC who receive both the CERB and their income assistance accessed more income and social supports and health support services, or less income and social supports and health services compared to income assistance clients in other provinces who had their entire income assistance benefits taken away. So we can also ask questions of the data about what works for recovery. So for example, with this pandemic, we know that the pandemic had a disproportionate impact on women. So we can ask questions of the data such as, did the BC approach to CERB, namely that income assistance clients receive both the CERB and their full income assistance benefit, did that approach help women with children who are receiving income assistance get back to work more quickly compared to income assistance clients in other provinces who lost their income assistance benefits and maybe weren't able to have enough money when the economy started to open again to be able to pay for childcare. So to answer questions like this, we can use administrative data from provincial social assistance programs linked with other data with the help of Statistics Canada and the RDCs, linked to things like tax data, educational data, and the health data that's in there. So working closely with the BC government, my research team, we've managed to get links from the administrative data from the BC Provincial Social Assistance Program to tax filer data and the health data and the education data. And I'm told that this is also available and potentially available in the RDCs for Ontario. Unfortunately, it's not available at this time that I know of for other provinces or even other provincial income and social assistance programs, so like programs for housing. There's so much interaction between provincial income and social support programs and federal income and social support programs, and the whole system is quite complex. The data can help us dig at this complexity, and more importantly, it can help us look at, during COVID-19, with the added complexity of the federal program of the CERB on top, how this added complexity on top of this big system of income and social supports affected these vulnerable populations. This type of evidence-based approach and looking at the data can help us design better income support programs in the case that we have, hopefully we don't have, but if we have another national emergency or a national pandemic. Thank you.
Thank you, Jillian, for your research on such important topics as income support, particularly for those who require the benefit the most, and for really using data to better prepare for and support such initiatives in the future, and also to assist in the recovery from the COVID pandemic. Now, to conclude our panel, it is my pleasure to introduce André Loranger, the Assistant Chief Statistician for Strategic Data Management, Methods, and Analysis and Statistics, Canada's Chief Data Officer, responsible for the overall stewardship of the organization's information data holdings. André has an MA in economics and began his career in the public services at Statistics Canada in 1997, where he spent most of his career compiling estimates of GDP. In recent years, André has been involved in international projects related to economic statistics, and he is currently a member of the United Nations Global Working Group on Big Data. André.
Thank you, Karen, for the introduction, and congratulations to the CRDCN for their anniversary, and also thank you to allowing me to participate on this panel. I'd also like to thank my panelists for excellent presentation and their kind words about Statistics Canada. I'm very pleased to have the opportunity to speak to you today. In my time today, I'd like to emphasize some of the key aspects of our modernization strategy and how it facilitated deeper analysis into the COVID pandemic. Many of you have likely heard of Statistics Canada's modernization initiative, which is designed to fundamentally transform the way that we do business and make the organization more user-centric. Its end goal is to strengthen the national statistical system, making data and information more relevant, more timely, and more accessible for Canadians. This involves substantial changes in how we collect and integrate data to produce relevant insights, moving from the traditional survey-based model to one which uses more alternate methods and data sources. Capacity building is an important element of our strategy, ensuring that we develop the data and subject matter expertise required to produce new data, new analytical tools, and new insights that support leading-edge analysis and research. Credible information is required to manage the pandemic. To progress, the progress we had made on our modernization initiative allowed us to quickly pivot to react to the crisis and get reliable information into the hands of Canadians faster. To coordinate our COVID-related research, we created a virtual data management and analytics service center through which we developed more timely economic and social indicators, new research products that documented the impact of COVID-19 on various facets of Canada's economy and society. At the same time, our data scientists and modeling experts continue to work with federal departments, including the Public Health Agency of Canada and Health Canada, to support efforts in understanding how the pandemic is likely to progress over the coming months. Our work on tracking and reporting the demand and supply of PPE is a good example of this collaboration. I would now like to take a few minutes to highlight some key initiatives that we've introduced since the onset of the pandemic in March. The agency quickly put in place innovative collection methods such as crowdsourcing and web panels to gather information on how the pandemic was affecting the lives of Canadians and their loved ones. We released a lot of analysis based on this data. We also ensured that these data were available in a timely way through the release of public use microdata files, and we are currently working to make more microdata available in the research data centers. We also created new ways for researchers to access data, including the provision of secure laptops and the ability to submit code remotely, leading to the innovative tools like the COVID-19 risk rewards assessment tool at UBC that Marie mentioned in her presentation. We continue to advance the implementation of a dynamic workplace where researchers will have remote access to microdata. Our virtual data lab initiative will bring microdata research to the forefront, removing barriers for trusted researchers on and off campus to better support analysts across the country. L'un des piliers de notre stratégie de modernisation consiste à produire des données plus détaillées, en particulier des renseignements géographiques plus détaillés pour les villes et les quartiers. Afin d'améliorer l'accès à ces données, nous avons déployé l'explorateur géospatial des statistiques canadiennes, un outil d'analyse qui permet aux utilisateurs de visualiser des données à des niveaux granulaires, de créer des cartes personnalisées et de télécharger des données géospatiales pour alimenter leur propre analyse. Nous avons accéléré la production de plusieurs indicateurs économiques qui sont essentiels à la production à la reprise. Il s'agit notamment d'estimations éclairs des ventes du secteur de la fabrication, des ventes au détail, du produit intérieur brut réel par industrie et des prix industriels. En même temps, nous avons également développé de nouveaux produits statistiques pour informer davantage la situation économique. Par exemple, des nouvelles données sur les ouvertures et les fermetures d'entreprises fournissent des renseignements sur l'ampleur des turbulences vécues par certains secteurs au cours de la crise. Enfin, pour répondre aux besoins de fournir des données économiques plus détaillées, nous avons introduit des indicateurs mensuels de l'activité économique pour les provinces et les territoires. Statistique Canada a des programmes de recherche reconnus qui réunissent des experts de divers secteurs spécialisés, notamment l'immigration, l'éducation, le marché du travail, la productivité, la dynamique des entreprises et la recherche en santé. Notre plan analytique à court terme vise à éclairer la réussite de la reprise et les répercussions sociales et économiques. En particulier, les impacts sur les Canadiens plus vulnérables et dans quelle mesure la reprise est inclusive. Par exemple, comment les perspectives d'emploi et revenus ont-elles changé après le confinement pour les jeunes Canadiens? Et de quelle manière les activités du marché du travail ont-elles changé pour les femmes à la lumière des incertitudes entourant les écoles et les garderies? Le programme de recherche à plus long terme se penchera sur les transformations profondes sur différents aspects de l'économie et de la société canadienne. En voici quelques exemples. En quoi l'accélération de la tendance vise vers la numérisation a-t-elle affecté les ménages et les entreprises? Dans quelle mesure la pandémie a-t-elle accéléré le rythme de l'automatisation dans certains secteurs? Et quelles sont les répercussions pour les travailleurs? Quel a été l'impact sur l'environnement, notamment la transition vers les technologies propres et la production verte? De façon plus générale, de quelle manière la restructuration industrielle a-t-elle affecté la productivité et la compétitivité de l'économie canadienne? Nos travaux de recherche sont effectués en collaboration avec plusieurs partenaires, incluant les universitaires. Nous supportons l'accès à de nombreuses bases de données de recherche couplées et leur utilisation par l'entremise des centres de données de recherche. Nous continuerons à travailler de concert avec le milieu universitaire par l'entremise du réseau canadien des centres de données de recherche pour faire progresser nos travaux et nous encourageons vos commentaires sur nos priorités de recherche et les possibilités de collaboration. Merci. Thank you. Back to you, Karen.
Thank you, Andre, for explaining how Statistics Canada was able to quickly pivot and implement innovative data collection and dissemination methods. As the tagline on your slides indicate, delivering insights through data can create a better Canada. I would like to thank all of our panel members for giving a snapshot of how using data can really achieve this goal. This now concludes the pre-recorded portion of this spotlight on the assessment and response to COVID-19. We invite you to please stand by as we transition to the live Q&A session with our panelists. If you have yet to do so, please submit your questions. The live Q&A is starting now. I would now like to take this opportunity to welcome all of our conference participants from across the country and beyond, and from multiple time zones. I'd also like to once again welcome and thank all of our panelists. We will now move on to the live Q&A session. So first, a question from Marie-Claude Rousseau, and this is for Lisa. In your interesting harmonization work for the COVID-19 testing data, are all of the provinces included? Have you made suggestions or recommendations to public health authorities in the province to enhance harmonization?
Thanks very much for that question. At this time, not all of the provinces and territories are able to link COVID-19 lab testing data to other sources of health data or even to social data. But the situation is evolving rapidly, and Health Data Research Network Canada is trying to stay abreast of that and to share on its website which provinces and territories have these data available, where it can be linked, and certainly the attributes of the data. And this information is being fed back to those in ministries of health across Canada so that they're aware of what the Health Data Research Network is doing, and potential interests in attempting to harmonize the data. So there is a continual connection between the network and what's happening in the provinces and territories.
Great, thanks, Lisa. Now a follow-up question for Andre. What lessons is COVID-19 underscoring about the need to harmonize health-related data acquisition and access across Canada from StatsCan's perspective? And what is the role of Statistics Canada in these harmonization efforts?
Thank you for the question. And your question, obviously related to health data, is important, but I'd like to go a bit broader. I think the value added that StatsCan brings to the table is the possibility of integrating all kinds of different data to answer relevant policy questions. And we do this because we have access to a lot of data to begin with, and also because of the frameworks that we have. For example, we can easily link information on a particular topic to our macroeconomic account framework, for example, to provide the economic impacts on particular issues and events. If we take that a bit further, you could do the same thing with health data. Obviously, one of the issues that we have is that the health data is currently not entirely available to StatsCan. There's data a little bit all over the place in provincial jurisdictions and municipal jurisdictions, and we need, as a society, to sort of make a more better use of that data to sort of get to the policy decisions that we need. Thank you.
Great, thanks very much. Now a question from Lucy Opsitnik, and this is for Marie. Can you please repeat the discussion on slide 3 of your presentation? even just at a very high level? Thank you.
Thank you for your question. So I believe slide 3 was the main one where we saw just a very quick snapshot of the analysis that we were able to do using the StatsCan data during the pandemic. It also had a bunch of links. And so those links have direct you to texts and the website where you will find the data. So, you know, you're free to then look at that and get more information. But in a nutshell, what this analysis is trying to do is we're trying to look at the risks and rewards associated with working in different occupations and industries. And the first, so there's different parts of the puzzle. And the first one is a risk index that's calculated for each occupation. So we take all occupations in Canada as, you know, from a standard list of occupation. And then we compute a risk index. It's a viral transmission risk index that's coming from characteristics of the job itself, such as do you work in close proximity with others, which is good for viral transmission or bad for public health? Are you in contact with the public? You know, the extent to which you're in contact with the public, the extent to which the worker is in contact with diseases or infectious diseases, and so on. So that's the first part of the index. The second part of the index are characteristics that relate to the workers themselves. And so the workers in those occupations, are they 60 years old or more, or do they live with somebody who is 60 and above? Do they take public transportation in general to go to work? Do they live in crowded dwellings? So looking at things that, you know, we assume to be bad for viral transmission. And so we put this all together and create a risk index. And to give you an indication, if you're a dentist, it's very, very high. So the index goes from 0 to 100, and I believe you're at like something like 98. If you're sort of a professional manager in the banking sector, you're about average, you're at 50. If you're an economist like myself, you're actually quite low at 23. I guess we don't talk to very many people, maybe that's why. But it gives you a range, right? So that's the risk side. The reward side is how many people work in that industry or worked pre-pandemic. We also look at job loss and the share of the sector to the provincial GDP. And I guess the question we were asking ourselves back when we started this was, well, everything was in lockdown, so sectors of the economy were closed, and we were trying to wonder, what do you reopen next? And the answer to this was partly based on how risky is that sector in terms of transmitting the virus, but also what reward do we get from reopening that sector? And I guess now we can flip the question and say, what sector do we close first? And you might want to close something that is riskier or something that brings you fewer rewards. So in a nutshell, that's it. I guess I could keep talking for an hour, but I assume we have other questions. So thank you for your question.
That's great. Thanks, Marie. This question comes from Ushnis Sengupta, and it's for Jillian. Ontario provides some open data on social assistance caseloads as open data. Do Alberta and other provinces provide similar data?
Right. So yes, Alberta provides open data on caseloads, so does BC. Haven't dug much into the other provinces as much. And although the open data is available, it's not very rich, at least not as rich as we can get, obviously, in the administrative data through the RDC. So the RDC administrative data, you know, gives us generally better demographics, age, gender, it gives us transactional data. So yeah, the income case counts out there.
Great, thanks, Jillian. Andre, what role do you see for Statistics Canada working with CRDCN researchers to analyze the longer-term socioeconomic impacts of COVID-19 and to inform public policy decisions?
I think we have well, first of all, we have a great partnership with the CRDCN. And obviously, our mandate is to inform society. So as Canada lives through this pandemic, we are pivoting our research agenda to explore those questions. So our research agenda is right now focused on the immediate concerns of the pandemic. We've produced, as I mentioned in my deck, a lot of new indicators through different methods as well to illuminate what is happening, with the pandemic. However, going in the longer term, we want to figure out what is the long-term economic impact on productivity, what is the impact on various social factors and indicators, and as well, what is the impact on perhaps the environment, and generally, how are all these impacts linked together? So we are developing this research agenda, as I've mentioned, and as we discuss this research agenda with stakeholders, whether they're partners within the federal public service or through universities and so on, we're open to exploring all kinds of research questions with researchers that are linked into the CRDCN and others. So for us, as I mentioned in my deck, we've embarked on a modernization strategy that seeks to become more user-centric. And the way to become more user-centric is to engage with various stakeholders and partners. And the CRDCN is one of those partners, and we're actively engaged in working with them on the research priorities of Canadian society.
Great, thanks, Andre. This question is for Lisa, Jillian, and Marie. What has the COVID-19 experience taught us about the need for CRDCN to develop a rapid response capability? Maybe we'll start with Lisa.
Well, and the short answer would be yes, we do need rapid responses in terms of recognizing how current data can be brought into the networks and linked to other sorts of data rapidly. And possibly in ways, I think another piece around it, and that I've been discussing with some of my colleagues in terms of how to make that available, recognizing privacy concerns. So for example, can we use data simulation techniques to produce data sets that aren't the real thing, but that enable us to rapidly analyze the data. And so creative ways to use, to link, to bring in new data and to make them available certainly are part of that response.
All right, because the spotlight is on me, so I'll keep answering. I guess I'll just draw on my own experience. And when, as I mentioned a little bit in the presentation, when the pandemic started and we both, I guess, lost our data access for regular projects, but new questions came to light. With the pandemic, we had new questions that weren't part of our research agenda prior to mid-March. With some colleagues started talking, and we realized we needed the access to the data we usually have access to. And so I think what the CRDCN did for us indirectly, because it wasn't in the data center physically, but it was through the division of StatsCan that deals with data access for researchers like us. We contacted them and we said, look, we have this issue. We want to do something. We want to help. And we also wanted to help the policymakers. It wasn't just our own our own research for our own publication needs. It was really like, we have this brain power. We're idle at our desks and in our home. And we want to do something. How can you help us do this? And they were very quick. And I think that really helped. I think we had all the infrastructure was there, so to speak, because they're used to sharing the data timely. Our analysis relied a lot on the labor force survey, which has very quick and timely releases of data. And so we were able to sort of tap that and go with that. One thing I want to mention too, in terms of a sort of a quick response from Statistics Canada that was very valuable for not necessarily for our project, but more in general. New questions were added to the labor force survey to ask people where, to tap more into the working from home thing. And so they ask, where were you specifically? How many days a week kind of thing? I don't know all the details, but really, I think that it showed that people were able to turn around on a dime and realize, well, we have these needs. We have to have answers. How can we tap our existing infrastructure to help here and get this data, give access to researchers like myself who had time and energy to devote to that.
Okay, me. So I would say, obviously, I think timely data is important. Working mostly with administrative data, I think there's a trade-off here, as Lisa said, about how do you get timely administrative data while protecting these people's privacy. I also think, and this is more of a wish list thing, that I wish we had more data on things like income volatility. So, we have things like tax filer data that's done on annual frequencies, and the labor force data you can kind of get at income volatility, but I think this is something that's still lacking in terms of data.
Great, thank you all. This question is for Lisa and Jillian. Can you comment on the implications of COVID-19 for underlining the importance of interdisciplinary research, and what should the role be of the CRDCN?
Okay, so thanks. I can start then. In terms of interdisciplinary research, such a richness. When I think of health, particularly in the work that I've done, bringing together people who have health and social science backgrounds is particularly important. Work around the impacts of COVID-19 on healthcare utilization, but also looking at particular risk groups and knowing where those exist in education, with income, race and ethnicity, those are critical. And so the teams that I worked with, and certainly through initiatives like the Health Data Research Network Canada that I referenced, there's a strong impetus to make sure that people from a variety of disciplines understand the kinds of health data that are available in Canada and how they might be linked together to answer novel questions. So profiling examples of that, Statistics Canada can do that. Other national networks can certainly do that to profile the kinds of innovative initiatives that go on with linked data.
And we'll let Jillian answer that last question as well.
All right, so for the research I've been working on, I've worked on a fairly interdisciplinary team. So I'm an economist, but on my team, we've got people with expertise in governance, with expertise in intersectionality theory. I think the way that the RDC could help with this is I find that sometimes, and definitely we're getting better at this, but sometimes in some of our surveys, we're not quite asking all the questions we could be asking. So on these different intersectionality aspects, so on race, ethnicity, on gender, these type of questions. And I know the labor force, we've just added a whole bunch of questions that I think is going to be very helpful in the future. I'd like to see this again, just more surveys. I'd like to see it more in the administrative data, but again, administrative data isn't always collected for data analysis purposes, so this might be a bit more difficult.
Now, this question is for Marie. In light of your preliminary analyses, what are the statistics on schools and COVID-19 telling us?
Those schools. So we look at workers in the analysis that I presented. And so we don't have data on children or viral transmission through children in schools. We look at, we do have teachers in the data. And when we compute our index, the risk index for teachers, elementary school and secondary school teachers, the index is medium. So it's not particularly risky, not particularly low, quite medium. I don't have the number off the top of my head, but medium. And I'll mention one thing here without spending too much time. What the risk index does here is it computes what I call the theoretical risk, in the sense that it's based on characteristics of the job and characteristics of the workers. But it doesn't look at actual outbreaks in school or caseload data by occupation, because as far as I know, those data are not available. They just don't exist, or they don't exist in a comprehensive manner. And so, so what we do here is just look at, well, we look at teachers. We say, okay, teachers are in contact with children, they're in contact with people through, through their work, they're a certain distance and whatnot. They work indoors, that kind of stuff. And so that's how we get the risk level. It's an average risk level.
Great, thanks so much. We do still have some extra questions. Unfortunately, I have to step off, so I'm now going to turn over the moderator role to Martin Taylor. And again, on behalf of McMaster, thank you all for your participation. Martin.
Okay, thanks very much, Karen. And we'll keep going for another 10 minutes, I think. So please stay with us if you possibly can. Andre, the question for you. In regard to health data, we know very well, of course, that those data are dispersed across different provinces and not always measured in quite the same way. StatCan in this context has partnered with CIHI, amongst other agencies. Do you see more linkage opportunities between agencies like StatCan and CIHI to generate more powerful data?
Thank you for the question. That's a very good question. I'd like to start by saying that the pandemic has highlighted data gaps in many areas, health being one of them, and those data gaps were pre-existing. And in the area of health, I mean, a lot of the data gaps I think point to this this dispersion, where there's data a little bit all over the place. And you're right, we have partnered with organizations like CIHI to produce statistics and information. And of course, we going forward, we see more opportunities to partner with various jurisdictions, as well our federal partners, Health Canada and the Public Health Agency of Canada, to really work out a mechanism by which all the health data can be shared and accessed by the people who need it. Ultimately, I think that's the ultimate goal for all of us seeking to get answers and relevant information related to the pandemic. So I would say absolutely, and we're actively working on this front on many areas, and we will continue to do so in the future.
Thanks, Andre. We've got a couple of questions, and I'm going to ask all of you to consider possibly responding to both of them. So the first one, if you could gain access to one new data set or one type of linked data set that is not currently available to advance your research on COVID-19, what would it be? So who'd like to kick off? Gillian, let's start with you. Or Marie, go ahead, Marie.
Yes. Well, I've briefly mentioned it. We don't know currently, or at least I don't know, the case, who got COVID and in what occupation. We have some information, like I see general statistics. I know the figures exist for cases by age, by region, gender, But as far as I know, we don't know anything about where those people work, if they work, where they work, which occupation and industry. So that would be my goal.
Okay, Gillian, your wish list.
Oh, if I had a wish list, it can be quite long. No, I would love to see more data on income volatility during COVID-19. Monthly income volatility, I had already mentioned this, particularly attached to, important demographics, attached to things like income, attached to things like savings. We don't have a lot of data on how much savings people have and if they were drawing down on those savings. So that's a very big wish list since the data doesn't currently exist.
Okay, thanks, Gillian. Lisa.
So what's been highlighted in some of the networks and certainly has been profiled in the news too is high quality information on both race and ethnicity that can be used with, say, COVID-19 lab testing data or with other healthcare utilization measures to understand the impact on specific groups within the population. And I've been, certainly the Canadian Institute for Health Information has put out some guidelines, and there's a bit patchwork in terms of where that information is collected, but it's not comprehensive across the country. And so that would greatly facilitate an understanding of at-risk groups for COVID-19.
Thanks, Lisa. So there you go, Andre. How are you going to respond to all of those wishes?
That's an interesting question. Again, I think the way to look at this is to say, sort of in all those data gaps that were identified, all the data needs, what do they have in common? Well, when I hear those data needs, I think about the level of granularity. So we need more detailed data. We need more disaggregated data by location and so on. And certainly we need more data on diversity to address some of those questions as to how the pandemic is affecting particular groups and so on. So it's not a question of there's no data here. There's data in all these areas, but the level of detail is not sufficient to answer the questions that are being posed of us. As a way forward, I talked about our research agenda at Statistics Canada a little bit. I talked about our plans. This is one area where we know we need to do better, and we are putting in place plans to sort of get at that disaggregated data. Again, through the pandemic, we've looked at different ways to sort of get at some of this information. We've introduced new methods like our crowdsourcing approaches, where we've asked specific questions at a very detailed level, and we're able to produce information, at those levels of detail that more than we would have done in the past. Now, is that the panacea? Does it solve everything? Absolutely not. We always we need to be vigilant and move forward with our data collection methods and so on to make sure that we can address those gaps.
Thanks, Andre. And of course, you're hearing, I think, consistently through today and indeed in previous panels, how responsive StatCan has been at short notice on several of these fronts. So we've got one late breaking question here coming in from Marie-Claude Rousseau, and I'll pose that to you, Marie. When the risk index is calculated that you spoke to, does it take into account the use of personal protective equipment or specific modifications of the workplace? And is it possible to model the effect that these measures would have on specific groups of workers in terms of their risk?
Very good question. And the answer is no, they don't take into account adaptation measures, personal protective equipment. This is a sort of pre-pandemic risk, in the sense that the job characteristics are all pre-pandemic. And so if you're thinking, how close are you to other people, this is based on pre-pandemic data. And so they don't take into account the potential adaptations that have been done since the start of the COVID-19. And so the second part of the question was, could we model those? Possibly. How, I'm not sure, because we would sort of need to either get more data information on which measures are being taken by which employers, or to figure out, say like wearing a mask or putting up plexiglass, which of the job characteristic they would affect. And so if we can bring the score down from a 5 to a 4, what that would do. Likewise, we have a lot more people are doing work from home, remote work, and the proportions that we use in the computation of the index are all based on pre-pandemic numbers. And so now we know, well, the numbers have skyrocketed, and so we actually have data on, and we could factor that in. But for what we currently have, the short answer is no, we don't take it into account. Could we? Maybe. That's future work, but that's the good thing as a researcher, there's always future work.
Okay, thanks, Marie. Okay, let's finish with this one then. And as I say, this can be addressed to any of you. And I'll start with Andre, and then others can come in. How do our efforts to assess COVID-19 impacts in Canada compare with or learn from the studies underway in other countries? We had a very interesting international panel yesterday, and not surprisingly, COVID-19 came to the surface several times. So what can we learn from, and how do we compare our Canadian experience with what's happening in other countries? Andre.
Oh, that's a good question. From a statistical perspective, I think we compare quite well. We have a lot of dialogues with our international colleagues, and if you think about it in terms of a spectrum, some countries are doing better in some areas than others. But generally, I think the work that we've done at Statistics Canada in the last 6 months to illuminate issues and data around the pandemic is very comparable. Some countries I think are doing a little bit more with respect to they've made a little bit more progress with respect to the actual health data, and again, I think that points back to some of the issues that we've discussed within Canada about the dispersion of the health data together. But overall, I think we compare very nicely, certainly from an official statistics perspective in terms of our contribution to responding to the pandemic.
Lisa, any thoughts from you on this one?
Yeah, yes, absolutely. Thanks so much. Well, I think where Canada can certainly be a leader is around innovative data linkages. Internationally, Canada is well known for the many different kinds of data that can be brought together to answer research questions from a multidisciplinary perspective. Our engagement with international partners, and certainly the networks that I've been a part of, have been focusing very much on what can be shared, particularly around standardization of information, so that when we do want to do international comparisons, we can make apples and apples comparisons as opposed to apples and orange comparisons. So being involved in initiatives around harmonization, standardization of information is critical for us, and recognizing that the work that's done internationally around those standards does need to come back and be adopted quickly, because that really promotes being able to respond efficiently in using our data.
Thanks, Lisa. Gillian, your thoughts?
I'm not gonna lie, I've been very focused on Canada, so I haven't done a whole lot of looking internationally. Although I will say this, and my viewpoint is still a almost completed PhD, it would be really great actually if the RDC could communicate that they were out there more. Because I know as a PhD, starting as a graduate student, I knew about the international data sets, particularly the US data sets, but I didn't know as much about the RDC starting. So I think if the RDC could do something a little better, or even our supervisors, our mentors, our people teaching research courses, just getting more information about the RDC out there would, I think, would really increase Canadian research.
We hear you. Thank you. Marie.
So to piggyback on what's just been said and to add a little bit, first, I didn't think I'd have much to say, but I know internationally, not everywhere, but other countries have implemented a remote access possibility to their national institutes of statistics. And so I think if Statistics Canada could figure out under which conditions or how to allow its researchers to have access to some data remotely. I'll start with some. That would be great. The kind of data that we're used to having access to in the data center, in some cases could be accessed remotely, and that I think would help researchers. And other countries are already doing it. Not everybody, there's conditions and this and that. I'm not the expert here, but I do believe that that's something that StatsCan should, really push to be at a comparable level to other countries in that respect.
If I can jump in here, we are working on that, and we will get get to a point where people have access to our data virtually.
Yeah, it is very much a work in progress. So thank you, Andre, for that. Okay, that brings us to the end of our session. Thanks for staying with us for these few extra minutes so that we could accommodate these additional questions. And I want to thank sincerely each of our panelists. Again, a super session, as all of them have been. And now, of course, we anticipate tomorrow the final session, privacy and microdata access, two worlds colliding. And this is an issue certainly that's come up repeatedly through several of the sessions. So it's a very fitting conclusion tomorrow. So please join us again, same time, same place, 1 o'clock Eastern Daylight Time tomorrow. And it will be a special closing event as well, in that we will be announcing the winners of our 3-minute graduate student competition as part of the closing remarks at the end of the session tomorrow. So thank you for joining us today. Thank you for your questions. And again, thank you to the panelists, and enjoy the rest of your day. Thank you all.